I am really scared to say this right now because if jinxing things really is true, then it makes me nervous to say it. But this is the first school year, and it's already what, almost October, and there hasn't been one note home yet, or one phone call, or one email from the teacher about the poor choices that he's making at school. So we dealt with our kid getting in trouble every single day. And it was all the way from minor little, he jumped like a frog in line instead of walking like a child, all the way up to he was incredibly disrespectful to his teacher in a way that we had never heard him talk to an adult before. And we didn't know if that was because he was dealing with something different in his brain and he really couldn't control himself, or if it was because he was high ability and he worked at a higher pace than other kids were able to. But then the emotions got so big and he was having night terrors that I couldn't wake him up from, a couple hours a night sometimes. And so, some pieces it seemed like ADHD, we would give him a direction at home, and 5 minutes later, he would still be in his room and he would have completely forgotten what we asked him to do. So there were things like that I felt like with my teacher background and the things I had learned about ADHD that maybe he was dealing with that. And I had seen students before who had really big emotions that they dealt with those, I don't know, the intense fits or tantrums, or and you hate for a kid to feel that way. So I knew that misdiagnosis can happen, especially when there's multiple things going on potentially. And so I liked, when we were told about the NEBA, how it had the potential for having a higher chance of hitting the nail on the head. The results really helped us because we were so unsure. Things were so confusing with the big emotions that he would have and the trouble he was always getting in at school. And the big emotions was the biggest one for me because he showed how unhappy he was sometimes. And just knowing from the NEBA that ADHD wasn't the primary diagnosis for him really was able to help us focus in, I think, on the anxiety piece a lot more. And, that's where Dr. Sanchez put his treatment, when we would come to see him. And yeah, I really felt like it got us to a better place where it just wasn't so confusing and gray. And when you're dealing with a kid and you don't know if you're doing things right as a parent, it just feels a lot better to know a cause of something and what isn't causing that something. That way you can really focus how you help and support your kid. So this school year so far, we're almost October, and he is in fifth grade, so he's older, and he's had time to mature some, but he's also been able to get some really focused help on the things that he deals with. And this is the first school year so far that we haven't heard from the teacher. Not only, we used to hear from the teacher several times a week. Now we haven't heard from her, and it's been a month and a half. And that feels really good. And he feels a lot happier about himself and who he is and the decisions that he's making.